Hello and welcome back. In today's episode, we're diving into Risk 12 alert symptoms of ovarian cancer. Your doctors never say. These are the hidden signs every woman and every family needs to know, because awareness could truly save a life. Have you ever felt a strange bloating in your stomach that just wouldn't go away? Or maybe a constant pressure in your lower belly that your doctor brushed off as just stress? What if I told you those subtle little whispers could be your body screaming about something far more dangerous? Something that claims the lives of over 13,000 American women every single year. Ovarian cancer is known as the silent killer. And here's the terrifying truth: more than 70% of women are diagnosed too late, when survival becomes a battle against the odds. That's why this isn't just another health video. It could be the one that saves your life, or the life of someone you love. Tonight, I'm not just giving you facts buried in medical journals. I'm giving you the 12 real warning signs of ovarian cancer that most people mistake for everyday issues. And symptom number 7, even most doctors rarely mention it, yet it shows up in thousands of early cases. If you're a woman, or if you love a woman, you cannot afford to miss this. Stick with me, because by the end of this video, you'll know exactly what to watch for, when to take action, and how to protect yourself and your family. This is personal, this is urgent, and what you're about to hear could truly make the difference between catching cancer early or finding out when it's too late. Symptom number 1, persistent bloating. Now I know what you're thinking. Bloating happens to everyone, right? You eat a big meal, you feel puffy, and by morning it usually goes away. But here's the difference when that stretched, balloon-like feeling in your belly lingers for more than 2 weeks. When your clothes suddenly feel tighter around your waist, even though you haven't gained weight. That's not just food. That's your body waving a red flag. In fact, a 2023 study published in the Journal of Gynecologic Oncology found that persistent abdominal bloating is the single most common early symptom of ovarian cancer. The danger is that most women dismiss it as digestion or just getting older. My advice: keep a simple symptom diary. If you're noticing daily bloating that refuses to go away, especially when paired with other issues like pelvic pain or appetite changes, it's time to talk to your doctor, because when caught early, treatment outcomes improve dramatically. And the next warning sign is even trickier, because many women confuse it with cramps. Symptom number 2, pelvic or abdominal pain. Picture this: you're going about your day, and there's this dull ache deep in your lower belly. It might feel like a pulling sensation, sometimes even a sharp jab. Most women brush it off, blaming digestion, exercise, or their menstrual cycle. But here's the truth: when that pain keeps returning for weeks, it could be the tumor pressing on nerves or stretching the lining of the abdomen. According to a 2023 study in JAMA Oncology, 63% of women with early-stage ovarian cancer reported pelvic or abdominal pain before diagnosis. The scary part: this pain isn't always intense. It can come and go, making it easy to ignore. But the pattern is the key. If it happens more than 12 days a month, your body is telling you something important. Don't wait. Don't guess. Get it checked, because the next symptom isn't about pain at all. It's about losing your appetite before you've even started eating. Symptom number 3, feeling full too quickly. Have you ever sat down to eat only to feel stuffed after just a few bites, even though you were hungry all day? That sensation, called early satiety, might sound harmless, but it can be one of the most overlooked warning signs. Here's why: as ovarian tumors grow, they press on the stomach and nearby organs, reducing its capacity. Sometimes fluid builds up in the abdomen, a condition called ascites, making you feel like you've eaten a Thanksgiving dinner, when in reality you've barely touched your plate. A 2024 study in the Indonesian Journal of Cancer confirmed that early satiety was a common complaint in patients before diagnosis, often combined with bloating or discomfort. So here's my tip: if you consistently feel overly full after tiny meals, and it lasts for more than a week or 2, that's not just eating light, that's a signal. Don't ignore it. And the next symptom, it'll hit you in one of the most basic daily routines we often take for granted. Take Linda, a 58-year-old mother from Ohio. She loved family dinners, but suddenly she couldn't finish half her plate. Her daughters noticed she'd push food away after just a few bites, joking that she was watching her figure. But Linda wasn't dieting, she was unknowingly battling ovarian cancer. By the time she sought help, the tumor had grown large enough to press against her stomach. If she had recognized that early satiety wasn't just a quirk, but a warning, her diagnosis might have come much sooner. Stories like Linda's remind us when your appetite changes drastically and without reason, it's never something to laugh off. It's your body whispering, and you owe it to yourself to listen. Symptom number 4, frequent urination or urgency. You might think running to the bathroom more often is just from drinking too much coffee, or maybe a mild bladder infection. But here's the catch: when that sudden urge shows up out of nowhere and refuses to go away, it could be something much more serious. The ovaries sit close to the bladder, and as tumors grow, they press on it, reducing its capacity. That's why you feel like you need to go, even when the bladder isn't full. A large study in the Journal of the American Medical Association found that 55% of women with ovarian cancer reported urinary changes compared to just 32% of women without it. That's almost double. So here's a quick tip: if you're waking up several times a night to use the bathroom or noticing urgency that never used to be there, track it. If it lasts more than a couple of weeks, talk to your doctor. Your bladder might be sending you a warning your ovaries don't want you to miss. And if that doesn't worry you enough, the next sign is one we often brush off as just being tired. Symptom number 5, unexplained fatigue. Imagine waking up after 8 solid hours of sleep, but still feeling like you've run a marathon. No amount of coffee fixes it. No nap makes it better. It's a bone-deep exhaustion that lingers day after day. Many women blame stress, age, or their busy lifestyle. But this relentless fatigue can be one of the earliest red flags for ovarian cancer. In fact, that research from the Oncology Nursing Forum revealed that over half of women with gynecologic cancers, including ovarian cancer, experienced extreme fatigue morning and night. And it wasn't just tiredness, it impacted their memory, mood, and overall quality of life. Here's what you can do: rate your energy on a scale of 1 to 10 each day for 2 weeks. If you find yourself consistently low without explanation, don't just shrug it off. Your body might be sounding an alarm. And the next symptom, it strikes in a place most women never want to talk about. Symptom number 6, pain during intimacy. This is one that far too many women suffer in silence. You go to be close with your partner, but instead of comfort, you feel a deep, sharp ache inside your pelvis. Often, doctors dismiss it as hormonal changes or part of aging, but the truth is, it can be a hidden sign of ovarian cancer. As tumors press on surrounding tissues and nerves, they create inflammation that makes intimacy painful, sometimes unbearable. A 2021 study in American Family Physician revealed that women diagnosed with early-stage ovarian cancer reported painful intercourse months before diagnosis, yet most were told it was just menopause. That delay cost precious time. So here's the bottom line: if intimacy suddenly feels physically wrong, don't ignore it, don't blame yourself, and don't suffer in silence. Talking to your doctor could be the turning point, because the next symptom, it goes even deeper. It's tied to changes in your monthly cycle that many women overlook until it's too late. Consider Maria, 62, who had been happily married for 4 decades. When intimacy suddenly became painful, she quietly endured it, thinking it was simply a part of menopause. She didn't want to worry her husband, and she certainly didn't want to bring it up at her yearly checkup. Months later, severe abdominal pain finally pushed her to demand further testing, where doctors discovered ovarian cancer in an early but aggressive stage. Maria told her daughters later, "If I had spoken up sooner, I might have spared myself so much fear." Her story is a powerful reminder: never ignore discomfort during intimacy. Your health and your future are too important to stay silent. Symptom number 7, menstrual irregularities. For many women, irregular periods are frustrating but easy to dismiss. Cycles get shorter, periods last longer, or the bleeding feels heavier than usual, most chalk it up to stress, age, or just hormones. But here's the alarming truth. Persistent irregularities could be your body's way of signaling something much bigger. A landmark study that followed over 15,000 women for 5 decades found that those with irregular cycles had double the risk of developing ovarian cancer by age 70 and nearly triple by age 77. Think about that. What we once thought was a minor inconvenience could actually point to a much greater danger. So if your cycle suddenly changes and it doesn't return to normal, don't ignore it, track it, ask questions, because these hormonal shifts may be telling a deeper story. And the next symptom, it's one that sneaks in through the digestive system, something so common that most people never connect it to ovarian cancer. Symptom number 8, indigestion or heartburn. We've all had that burning after a heavy meal or that bloated feeling when we've eaten too fast. But when indigestion or heartburn becomes a daily routine, that's when you need to pause. Research from the UK Collaborative Trial of Ovarian Cancer Screening revealed that 35% of women with early-stage ovarian cancer reported persistent digestive issues like indigestion and heartburn more often than even gynecological symptoms like bleeding. That flips the script completely. Your stomach pain might not be about food at all. If you're postmenopausal and still struggling with chronic indigestion, especially when medications don't help, that's your cue to push for further testing. Because sometimes the stomach is not the problem, it's the ovaries. And the next symptom, it doesn't just make you uncomfortable, it can physically change the way your body looks and feels. Symptom number 9, a swollen abdomen with fluid. Imagine looking in the mirror and noticing your belly slowly getting bigger. Even though your weight hasn't changed, your jeans fit tighter, your waistline expands, yet the scale stays the same. That's not fat, it's fluid. In ovarian cancer, this condition is called ascites, and it happens when cancer cells irritate the lining of the abdomen, causing fluid to build up around the organs. It's more than uncomfortable, it can make it hard to breathe, eat, or even move freely. According to Nature Reviews Cancer, women with newly diagnosed ovarian cancer often presented with moderate to severe ascites that indicated advanced disease and worse outcomes. If swelling keeps coming back or keeps getting worse, don't just think it's weight gain or bloating. Ask for a pelvic ultrasound or imaging. Your body doesn't change shape for no reason. And the next symptom, it tricks thousands of women every year because it feels exactly like a stomach bug, but it doesn't go away. Now let's talk about Karen, a 67-year-old grandmother. She loved gardening and believed her growing belly was just grandma weight. Even her friends teased her about enjoying too many pies. But Karen wasn't gaining fat, she was filling with fluid. When she finally went to her doctor, she learned that ascites, the buildup of abdominal fluid, was a hallmark of ovarian cancer. Karen admitted later, "I wish I had realized sooner that swelling without weight gain is not normal." Too many women mistake these visible changes for aging or diet, when in reality, they're urgent red flags. If your belly changes shape without explanation, don't laugh it off or hide it under loose clothes. Your body is trying to tell you something serious. Symptom number 10, nausea and vomiting. At first, it feels harmless. You think it's just food poisoning, a mild stomach bug, or something you ate that didn't sit right. But when nausea and vomiting keep coming back with no clear cause, that's when the red flag rises. As ovarian tumors grow, they can press against the stomach or intestines, slowing digestion or even blocking part of the bowel. That's why the nausea lingers, why vomiting appears suddenly and unexpectedly. A 2022 study in gynecologic oncology revealed that 36% of ovarian cancer patients reported nausea or vomiting during diagnosis, often misattributed to ordinary GI problems. Too many women delayed seeking help, assuming it was diet or stress, and that delay cost precious time. Here's the tip if nausea shows up for more than a week without explanation, especially if combined with bloating or pain. Don't ignore it. Push for answers, because nausea without cause is never just nothing. And the next symptom is one that surprises almost everyone. It shows up in your legs. Symptom number 11, pain in the legs or thighs. This one often flies under the radar. You feel a deep ache, cramping in your thighs, maybe even a heaviness in your legs. Most people blame muscle strain, sciatica, or a pinched nerve. But ovarian tumors can press on nerves and blood vessels in the pelvis, disrupting circulation and radiating pain downward. A 2024 case study in the American Journal of Case Reports described a 31-year-old woman misdiagnosed with musculoskeletal issues for 2 years, only to discover she had a large ovarian tumor pressing on her nerves. Once removed, her pain vanished completely. That's how deceptive ovarian cancer can be. It mimics everyday problems. If your leg pain is new, persistent, and unrelieved by usual treatments, don't just assume it's sciatica. Your ovaries might be the hidden culprit. And if you think that's surprising, wait until you hear the final symptom, one that most women find too uncomfortable to talk about. But it could save your life. Symptom number 12, unusual vaginal discharge. For many women, changes in discharge feel minor, even embarrassing to mention. But when it becomes watery, bloody, foul-smelling, or simply persistent and unusual for you, it could be one of the few outward signs of ovarian cancer. Certain tumor types can disrupt tissues or produce hormones that cause abnormal secretions. The CDC has documented cases where persistent unusual discharge was the only noticeable symptom in women with early-stage ovarian cancer. Think about that. The only clue was something so easy to dismiss. Here's the takeaway: if your discharge doesn't look, smell, or feel normal, don't self-diagnose and don't ignore it. A simple conversation with your doctor could mean the difference between early detection and late discovery. Awareness is everything. And now you know the 12 silent warning signs that could change everything for you or someone you love. So let's quickly recap. We've uncovered 12 subtle but powerful warning signs of ovarian cancer, things like persistent bloating, unexplained fatigue, digestive changes, and even unusual discharge. None of these symptoms alone mean cancer, but together, they paint a picture your body doesn't want you to ignore. The most important step you can take is simple: listen to your body, track what feels unusual, and never hesitate to seek medical advice. Early detection saves lives, and yours matters. If you've watched this far, that already shows your courage and commitment to protecting your health. Remember, you are not alone in this journey. Millions of women feel the same fears, the same confusion, and the same questions, but awareness is the first step toward control. Now, I'd love to hear from you. Which of these symptoms surprised you the most? Or have you ever experienced one of them and brushed it off? Share your story in the comments. We read every single one, and your words could help another woman feel less alone. And here's something important. Don't just watch and move on. Save this video so you can come back to it whenever you need a reminder, and share it with the women you love. It might just save their lives. And if you haven't already, subscribe to our channel and hit the bell icon so you never miss our future videos. We bring you the latest science-backed health insights, not only about ovarian cancer, but also about kidney health and other vital topics that can transform the way you care for yourself and your family. At the end of the day, your health is your power. You deserve to live with strength, awareness, and hope. So stay safe, stay curious, and remember, knowledge isn't just information, it's protection. Together, we can take charge of our health and our future.